When visiting the doctor, chances are you didn't check what type of doctor they are. D.O. versus M.D.? Perhaps you didn't even realize that there were two different health training routes one can take to become a doctor. An M.D., indicating completion of a Doctor of Medicine degree, is the most common educational path completed by physicians and accounts for 89% of actively practicing physicians in the United States. D.O. physicians, indicating completion of a Doctor of Osteopathic Medicine degree, make up approximately 11% of practicing doctors in the United States. In general, an M.D. and a D.O. fulfill the same roles. D.O.s and M.D.s pursue specialties in all areas and complete similar residencies, prescribe medications, and can practice in all 50 states. The main difference in D.O. versus M.D. is that D.O.s complete additional hands-on training in a healthcare technique termed osteopathic manipulative medicine, OMM. While there may have been vast differences in the past between D.O. versus M.D., today both types of physicians get the same training in medical school, take the same licensing exams, and fulfill the same roles providing care to patients. D.O. versus M.D. What education is required to become an allopathic medical doctor and earn an M.D. degree? An M.D. is a doctor who completed their health training at an allopathic medical school and earned a Doctor of Medicine degree. There are 156 allopathic medical schools in the U.S. where pre-med students are accepted and go on to complete their M.D. degrees. Allopathic medical schools consist of preclinical health studies and clinical hands-on training, taking care of hospital patients. Once physicians have graduated from allopathic medical schools, they complete more specialty-specific health training in a residency. Some residencies that an M.D. could complete include surgery, internal medicine, obstetrics and gynecology, and primary care, such as family medicine. Towards the end of residency, an M.D. will complete their medical specialty board exams. Once medical specialty boards are passed, an M.D. is fully qualified to practice medicine and care for patients. D.O. versus M.D. What education is required to become an osteopathic medical doctor and earn a D.O. degree? D.O. stands for Doctor of Osteopathic Medicine. A D.O. is a doctor who completed their training at an osteopathic medical school and earned a Doctorate of Osteopathic Medicine degree. A D.O. completes the same curriculum, classwork, and hands-on clinical training in osteopathic medical school as an M.D. does. Osteopathic D.O. physicians then go on to complete the same residencies as an M.D., often working together throughout residency and after. They take the same specialty board exams as an M.D. and go on to practice the same jobs. The main difference between an M.D. and a D.O. is that a D.O. has a more holistic philosophy and learns osteopathic manipulative medicine, OMM, also termed osteopathic manipulative technique, OMT. When in medical school, osteopathic medical students complete at least an additional 200 hours of osteopathic manipulative medicine in addition to the standard medical courses. Osteopathic philosophical ideals focus primarily on the musculoskeletal system and treat symptoms and conditions such as low back pain, muscle strain, stiff joints, buildup of edema, neck pain, etc. In general, a larger percentage of D.O.s compared to M.D.s, almost 57% according to the American Medical Association, go into primary care specialties, including family medicine, internal medicine, and pediatrics. There are currently 44 accredited osteopathic medical schools in the U.S. and over 121,000 practicing D.O. healthcare physicians. Is residency different for an M.D. and a D.O.? Prior to 2020, there was a separate medical residency match for allopathic and osteopathic doctors. However, in 2020, the GME, Graduate Medical Education, and AOA, American Osteopathic Association, started a singular accreditation system and residency match for both M.D. and D.O. students. This system allows for both trainees to apply for the same positions in residency programs, such as primary care, after completing school. The only difference in residency for an M.D. and D.O. is that osteopathic students can be board certified in osteopathic manipulative medicine. A D.O. medical residency in osteopathic manipulative medicine, OMM, is usually paired with neuromuscular medicine, NMM, and is termed a OMM-NMM residency program. According to the D.O., a medically reviewed journal published by the American Osteopathic Association, residents in a OMM-NMM residency programs complete more medical rotations in neurology, orthopedics, rheumatology, pain management, and physical medicine and health rehabilitation. Do students need to complete additional requirements for admission to an osteopathic medicine school to become a D.O. compared to M.D. school? The requirements that medical school admissions services request from pre-med students are almost identical for M.D. and D.O. medical schools. Pre-med students applying to both M.D. medical school programs and D.O. osteopathic medical school programs must first complete the required prerequisite courses at their undergraduate school, which primarily include biology, chemistry, math, and physics. Another requirement is shadowing an M.D. or D.O. physician. Many osteopathic school admissions services require that applicants spend more than 20 hours shadowing a D.O. physician specifically to be exposed to osteopathic manipulative medicine, OOMM. Student applicants must also take the medical college admission test, MCAT. Other additional aspects, like leadership, volunteering, and research, can also help boost an application to medical school. Once all the required aforementioned steps are complete, students can complete their primary application and submit it to D.O. and/or M.D. schools. This application will contain past volunteer work, classes completed, the number of shadow hours, leadership positions, a letter of recommendation, and research, in addition to MCAT scores and GPA. Students must also write a personal statement that will be released to each medical school admissions committees. The personal statement is a page-long essay detailing facts about the student applicant and why they wish to become a D.O. or M.D. doctor. Students may select which M.D. or D.O. schools receive their primary application. If students' primary applications, including MCAT and GPA, are up to the school's admissions requirements, then the applicant will be invited to complete a school-specific secondary application. The secondary application usually consists of essay questions for the student applicant to complete. If the secondary application is accepted by admissions, then the student applicant will be invited to interview at the M.D. or D.O. medical school programs. What does a student learn at osteopathic D.O. medical school? In addition to the preclinical and clinical coursework completed in allopathy med school, osteopathic medical students complete at least 200 training hours in osteopathic manipulative medicine, OMM, during D.O. school. This training includes both didactic-based lectures to learn the pathophysiology and anatomy associated with OMM, as well as an in-person hands-on lab. In lab, D.O. students practice and perfect OMM techniques including muscle energy, facilitated positional release, and stills technique. Do I need a good MCAT score and GPA for admission to M.D. or D.O. school? A good MCAT, medical college admission test, score is usually required for admission to both M.D. and D.O. medical programs. Statistics show there is about a 5-point score difference between students that are accepted to M.D. programs and students that are accepted to D.O. programs. Overall, the average MCAT score is 500. The average MCAT of admitted students to M.D. programs is 508.7, while the average MCAT of admitted students to D.O. programs is 503.8. A good GPA, grade point average, is also required for admission to M.D. and D.O. medical schools. Pre-med health students often have their GPA broken down into science GPA, S GPA, and normal GPA. Having a high science and regular GPA is vital when applying to become an M.D. or D.O. The average GPA of students accepted into D.O. school is 3.54, while the average GPA of students accepted into M.D. school is 3.70. If your GPA is low, one can take additional courses to raise it. Additionally, pre-health applicants can work to strengthen other areas of their M.D. or D.O. school application, like achieving a high MCAT score. Participating in other services, like volunteering or leadership, can also help to strengthen an M.D. or D.O. school application.